welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I have a very interesting topic to discuss with all of you. Now, we all know that constipation is a common problem in pediatric age, with prevalence often ranging up to 29% of normal frequency, and consistency of the stool varies with children's age as well as their diet. Now, there is also a considerable variation across children, that is, each child is definitely different. So, to give us more information about this interesting or this important topic, we have with us today Dr. Lavenya R Padmanaban, who is a consultant at Pediatric Gastroenterology and Hepatology. The patient.
Sure. See, as I said to begin with, 95% of the time constipation is functional in children. But it doesn't mean they do not need a referral to a specialist. Why? I'll tell you. Many times they don't respond to treatment adequately, or the underlying lifestyle factors are not effectively addressed. So there is ongoing problem, or once they stop the medications, it's very common parents come back and say, we stopped the medicine last week, again this week he's got the same problem. So how long is the child going to need medicines? So these are questions that have to be really effectively addressed. I consider this itself as a red flag needing referral so that they can be effectively educated and treated appropriately. Any child who is not responding to your medical management, adequate doses of laxatives, please send them to a specialist, let them get evaluated. Any child where you find any other symptoms, like child is not growing well, child has anemia, child has some other findings that make you worry, so please send them immediately. It may be constipation with an underlying problem like celiac disease, or it may be constipation with an unrelated problem also. And any child who has developmental delay, who has muscle weakness or nervous problems, these children are bound to have refractory constipation, difficult to treat constipation, so please refer them early. Any child you suspect to have problems with for example, with delayed motor milestones, not walking, running at the appropriate age, child has both bowel and bladder problems, please refer them early. I see children with constipation as well as they have bedwetting problems, they have urine leakage in the daytime. These children need definitely further evaluation and management appropriately. So such children, please refer them early. Any infant where you see constipation onset before the weaning period, from very early on. Sometimes there is good classical history of delayed passage of the first baby stool called meconium. Sometimes you don't get that history, but you will hear from parents that from the first week, second week, this baby has been struggling, baby has needed rectal stimulation, baby has needed some medicines through the bottom. So these kind of history, if you get, please refer them early. It could be something to do with organic constipation.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.